Alrighty, don't know how you really want me to set this up, but hopefully this works. Let me know if it doesn't. Okay, so I'm gonna go to my patient. So knock, knock, knock. Hi, my name's Callie. I'm gonna be your student nurse. Is it okay if I come in today? Perfect. Shut the door, provide privacy. Before we get started, can I verify your name and your date of birth? Perfect, perfect. Check the wristband. Everything looks good. I'm just gonna wash my hands, put some gloves on, write my name on the board, make sure the wheels are locked, raise the bed. All right, so Erin, they tell me that you're having some pain in your left leg. Is that correct? Is that what's going on? Yeah, okay. How long have you had this pain for? Just since yesterday, okay. And how would you describe this pain? It's like a Charlie horse, pretty painful to touch, okay. How would you rate it from 0 to 10? 10 being absolute worst pain you've ever experienced. An 8, okay. You said that touching it makes it worse, things like that. Does it stay pretty central to that area in your leg, or does it go anywhere else? Stays pretty central, okay. Well, let me take a look at your incision here. The incision looks great, clean, dry, and intact, no abnormalities, so that looks really good. I want to take a look at your leg here. Yeah, that definitely feels really warm on that left leg. It, notice 1+ non-pitting edema, tender to the touch, Homan sign can be positive, so that looks pretty painful. Have you been ambulating or moving around at all at home, walking around? Oh, you've been into watching The Bachelor, huh? Man, I haven't been caught up on this season, but I've been told it's pretty good. You're liking it? Good, good. Okay, well, I just want to do a few other tests. GI and GU looks good. Heels oriented × 4. Lung sounds clear. Heart sounds clear. Normal. The cap refills less than 3 seconds. The strength is 5 out of 5. Everything looks good, so we're mainly just focusing on this leg here. Also, vitals, I got them from my aide, and they blood pressure is 148/96, pulse is 92, respirations are 14, temperature is 98.3 degrees Fahrenheit, and he is on room air. All right, Erin, are you taking any medications for blood pressure or other things? Oh, you're taking amlodipine. Okay, did you take that throughout this time? You have been taking it. Okay, well, alrighty, Erin, I'm gonna go ahead and call the doctor. We're gonna see what we can do to make you feel better, and I'll be right back, okay? So I'm gonna take my gloves off. I'm going to wash my hands, lower the bed, make sure he has everything, and I'll be back in about 15 minutes, okay? Perfect. Alrighty. So, now I'm going to call my doctor at the nurse's station. Okay, ring, ring, ring. Hi, Dr. Johnson, this is Callie calling from the emergency room. I've been working with Aaron Brown here. He's a 62-year-old male admitted today for left lower extremity pain. He is about 5 days post-op from a left knee replacement, and his pain started yesterday. He has, after doing an assessment today, I've noticed some 1+ non-pitting edema. There is some redness to his left calf, some tenderness to his left calf, warmth to his left calf. We did Homan sign, and that was positive. His incision site is actually pretty clean. It looks dry. It looks like there's no leakage, no drainage. So everything looks good there. His vital signs are normal, except his blood pressure is elevated to 148/96. He has been taking amlodipine 10 milligrams daily, but it doesn't seem to be helping at all. We don't have any labs yet, but besides that, he is allergic to penicillin. He is a full code. I am recommending that we get an ultrasound for this potential DVT in his left calf, start some anticoagulants, maybe get a D-dimer test, and refit him for some compression stockings because he was mentioning that his TED hose are no longer fitting him, which would be part of that edema. What would you recommend that we do? Okay, I'm gonna write all of this down. All right, well, let me just read these back to you before you go. You'd like to get an ultrasound of the left lower extremity. You'd like to get a CBC, CMP, PTT, a D-dimer. You'd like Loratab 7.5, 500 milligrams, 1 to 2 tablets, Q 6 hours, PRN for pain. Lovenox injection, 40 milligrams, sub-Q, Q daily times 10 days. Strict bed rest till the ultrasound results come back positive for a DVT, and a thigh-high stockings fitted, and education on how to put those on. Is that correct? Perfect. All right, Dr. Johnston, thank you. We will see you in 2 hours, and I will call you once we have those results. Thank you. All right, now I'm going to document everything, and should be good.